2, 1.
All right, my name is Justin Turner. I'm doing a quick head-to-toe assessment on Bill here. But prior to doing the exam, we've done a comprehensive medical history, a cognitive exam, as well as a Snellen eye test and determined that his vision is 20/20. We're going to start off with the head, doing the cranial nerves, starting off with cranial nerve number 1. So Bill, go ahead and plug your right nostril and close your eyes for me. Tell me what you smell there.
Nothing.
Okay. Go ahead and plug your left nostril. Tell me what you smell here.
Nothing.
Do you have issues with smell? Is that something that's normal for you?
Yes, I have nasal polyps, and I've had 4 surgeries, and I lost my smell about 4 years ago.
Okay, well there you have it. Now we're going to move on to the other cranial nerves. We've already assessed cranial nerve number 2 with the Snellen eye exam. We're going to move on to cranial nerves 3, 4, and 6. So go ahead and raise your eyelids for me. Open your eyes wide. Perfect. And I'm going to have you track my finger. You can relax your eyes now. Keep your head still and just follow my finger, okay? Okay, perfect. Now with the flashlight, I'm going to assess his pupils. I'm going to shine a light in each eye. I'm going to assess them for being round, how they react to light, as well as their regularity. And then I'm going to check for accommodation. So go ahead and just look at my nose, and then look over in the corner in the back of the room, and the back of my nose. Perfect. All right. Great. Okay, now I'm going to move on to cranial nerves 5 and 7. So go ahead and puff your cheeks out like this for me. Perfect. Okay, now open your mouth wide.
Mm-hmm.
All right. And then go ahead and close it tight. Clench your jaw for me. Perfect. Okay, go ahead and smile. Big smile. And frown for me. Perfect. Can you wrinkle your forehead like this? Wrinkle it real good. There we go. Okay, perfect. And then go ahead and close your eyes. Can you feel this?
Yes.
Does that feel normal? How about here?
Yes.
Okay, how about here?
Yes.
Okay.
Yes.
All right, perfect. Moving on now to cranial nerve number 8. Go ahead and plug your left ear for me. There you go. Yeah, your left ear, and I'm going to whisper something in your right. Tell me what I'm saying. Did you hear that?
I did not hear that. Try again.
Banana.
Banana.
Okay, perfect. Go ahead and switch ears. Strawberry.
Strawberry.
Okay, perfect. Are you hard of hearing at all? Or?
No.
Okay. Perfect. All right, we're going to move on to cranial nerves 9, 10, and 12. So go ahead and stick your tongue out for me. Perfect. Open your mouth nice and wide for me. I'm going to check, at this point, I check a gag reflex. I'm not going to actually do that to you, but it's by sticking something down. Okay. And while I'm in there, I would with the light, I would check, go ahead and open up. I would check around for any abnormalities, make sure everything's moist and appropriate. And I'm going to go ahead and just swallow for me. Perfect. All right, thank you. I'm going to move on to cranial nerve number 11. So go ahead and just shrug your shoulders for me. Perfect. Now turn your head to the right. Now press your head against my hand. Turn your head to the left. Press your head against my hand. Okay, perfect. All right. So I'm going to go ahead and move on to some coordination. We're done with the cranial nerves. So I'm going to have you just take your right hand and touch your nose. Left hand and touch your nose. And then we're going to stand up here. And I'm going to need you just to stand on your right foot and balance. Okay. Stand on your left foot and balance. Okay. Now take your right heel. Rub it down your left shin. That's kind of difficult. Left foot, left heel, down your right shin. Okay, perfect. Now walk towards me on your heels. Okay, now turn around and walk back heel to toe, normal heel to toe. Okay. All right, perfect. We're going to move on to, I'm going to sit back down now. I'm going to finish up my head assessment, so I'm going to assess the skin, make sure there's there's no abnormalities, any cancer spots or lesions. I'm going to assess for symmetry, the hair as well, anything that's out of place. At this point, I would assess his ears. So I would look in with an otoscope and assess for any abnormalities, make sure that the eardrums are reflective and white. I would look at both nostrils, assess the turbinates, and make sure that everything looks appropriate and that there's no deviated septums and everything is moist. I might move down to his throat and I would assess his thyroid, make sure it isn't out of proportions or enlarged. At this point, I would check lymph nodes, as well as the trachea, make sure it's in line and everything looks appropriate. I'm going to check carotid pulses on both sides. And then with the bell of my stethoscope, I'm going to check for any carotid bruits. Okay, perfect. And at this point, I'm going to move on to his thorax and then follow up with the cardiopulmonary assessment. So I'm going to move on to the posterior portion of his thorax. I'm going to assess for any tenderness in the vertebral columns, any CVA tenderness or kidney tenderness. Make sure there's no abnormalities. I'm going to do a lung assessment. Starting posteriorly, I'm going to start at the top of the lungs. I'm going to work my way down to the bases. Go ahead and breathe normal for me. Then I'm going to speed this process up. I'm going to avoid the scapulas, just alternating sides. Listen for any abnormalities. And then down into the bases on the lungs. Okay. And then I'm going to move forward to the anterior portion of the assessment and listen to his lungs on the front, following a similar pattern, starting at the top, alternating and working our way into the bases of the lungs. Then I'm going to move on to the heart. I'm going to start just right at the sternal border, second intercostal space, listening to the aortic valve, and then move on to the left sternal border, second intercostal space, to the pulmonic, and then the third intercostal space on the left side still, Erb's point, fourth intercostal space, tricuspid, and then over to the mitral. And here I can get an apical pulse for 1 minute. And then after completion of the cardio assessment, I'm going to move on to an abdominal assessment. So I'm just going to have you lay down here. And I'm going to start the abdominal assessment listening in all quadrants for any abnormalities, for bowel sounds, assessing for any high-pitched or hyperresonance. At this point, I'm also going to assess the skin, make sure there's no pulsations in the abdomen or any masses or hernias that are visible. I'm going to follow this up with some light palpation and just let me know if any of this is tender, okay? In all quadrants here. Feeling for any masses, any tenderness, any rebound tenderness. There's none noted. I'm going to move on to some deep palpation. On the right side, I'm assessing for any enlarged liver right underneath the clavicles on this right upper quadrant. And the left upper quadrant, I'm going to assess for any enlarged spleen. Move on to the lower quadrants, assessing for any masses or any abnormalities. And then I'm going to move on to an extremity assessment at this point. So go ahead and come back up here for me. Stay sitting there. So I'm going to assess the skin. I'm going to assess for any edema or abnormalities. I'm going to check some radial pulses. Cap refill. Look for any clubbing of the fingernails. Go ahead and squeeze my fingers tight here. Okay, don't let go. Perfect. Strength is good. I'm going to move down to the lower extremity. I'm once again assessing for any edema, any ulcers, any venous stasis or discoloration. I'm going to check a pedal pulse. Check cap refill on the toes. Assess for any skin issues. And while I'm here, I'm going to assess for any pain, any Holman sign. So any pain in your calf when I do this. I'm also going to check for any clonus. Go ahead and relax this for me. As I press and let go, if there is clonus, we'll get a twitch or like a flexion in the foot. It'll kind of twitch after, and there doesn't seem to be any. Signifies some neuronal abnormalities. I'm going to also, while I'm down here, do some deep tendon reflexes. So I'm going to do it with a deep tendon reflex hammer. I'll do patellar tendon on both sides, Achilles on both sides. And then I'll move on up and do a bicep tendon reflex, brachioradialis, bicep, brachioradialis, as well as, and relax this arm for me, the tricep, okay? And after completing The deep tendon reflex, the assessment is done, and we'll terminate it here.